Good afternoon. I'm Cindy Hall, president of the Women's Congressional Policy Institute, WCPI. Welcome to our Capitol Hill lunch briefing on women veterans' mental health, suicide prevention, and military sexual trauma. For almost 20 years, we have hosted an annual event honoring women veterans, a tradition we plan to continue for many more years to come. As most of you know, WCPI is a nonpartisan, nonprofit public policy organization. Our mission is to bring together a community of bipartisan women policymakers and trusted partners to advance issues of importance to women, develop the next generation of women leaders, and foster a more effective and representative democracy. And we work closely with the members and staff of the Bipartisan Women's Caucus. Today, we will be hearing from a very distinguished panel, including Dr. Amy Street, Naomi Mathis, and Caitlin Yancey. Each of them will be bringing a different perspective to this important issue, and we thank them for participating. Our special thanks to Otsuka America Pharmaceutical Inc. for their support for this briefing. We appreciate their commitment to women veterans' mental health and their work to research and develop medical treatments to improve the lives of people with brain health conditions. I would like to thank our congressional briefing co-sponsors, the leadership of the Bipartisan Women's Caucus, Congresswomen Kat Cammack and Susie Lee, co-chairs, and Congresswomen Monica de la Cruz and Amelia Strong-Sykes, vice chairs. Our thanks to our longtime partners, DAV and IAVA. We are grateful to both for their partnership and work on behalf of women veterans for many years. And a shout out to one of our remote participants, Dr. Irene Trowell-Harris, former director of the Center for Women Veterans. Dr. Trowell-Harris was the first African-American woman to achieve the rank of Major General in the U.S. National Guard. She's a longtime supporter of our organization and a former panelist several times over. Lastly, before we begin, on behalf of WCPI and our partners today, I want to thank any attendees who have served or are currently serving in the military. And I invite any of you in the room to please stand. We thank you, each of you, for your service. Thank you for joining us today. We will not forget. We will be posting live on social media during the briefing, and we encourage you and others to do so using the hashtag WCPIVets. According to the Veterans Administration, the rate of suicide among women veterans is nearly twice as high as that of male veterans, and about 1 in 3 women say they have experienced MST, military sexual trauma. As you will hear from our speakers today, we hope this discussion will help provide some new perspective and insight into the mental health challenges facing women veterans, particularly MST survivors, and how policymakers can better address and respond to this continuing crisis. It is now my pleasure to welcome our first panelist, Dr. Amy Street. Dr. Street is the National Director for Military Sexual Trauma in the Office of Mental Health and Suicide Prevention at the Veterans Health Administration within the Department of Veterans Affairs. She also is an Associate Professor of Psychiatry at Boston University School of Medicine. Dr. Street has decades of experience, having published more than 100 peer-reviewed journal articles, primarily focusing on providing care for survivors of interpersonal violence while working with women veterans and promoting best practices related to services for veterans who have experienced sexual assault or harassment during their military service. She also is the lead developer for Beyond MST, a self-help mobile app designed to support psychological recovery among individuals who have experienced MST. Dr. Street.
Thank you so much, Cindy. And thank you all. I am very grateful for the opportunity to speak today about the Veterans Health Administration's approach to providing care for veterans who've experienced military sexual trauma. I'm not a veteran myself, but it's been a true honor for me to have spent my career serving veterans. Our nation owes a debt to those who are injured emotionally or physically by experiences of military sexual trauma. That debt can never be repaid, but justice requires that we do everything in our power to create the tools and systems necessary to promote recovery among survivors. Military sexual trauma is a difficult and painful topic, but it's critically important that we speak openly about it. Doing so is a means to confront the stigma and secrecy that often accompanies experiences of sexual trauma. And it's also an opportunity to spread the word to survivors about the resources to which they are entitled and that can support them on their recovery journey. As most of us know, military sexual trauma, it's often abbreviated MST, I'm certain I will use that acronym today, is a term that refers to sexual assault or sexual harassment during military service. And while we're here today to talk specifically about women's health, we know that individuals of any gender can experience military sexual trauma. In fact, over a third of the patients seen in the Veterans Health Administration who experienced MST are men. Individuals of all genders and all backgrounds can experience MST. Individuals of all ages, all races, all ethnicities, all sexual orientations, and of all physical sizes and shapes. Because of this, it's Veterans Health Administration policy that all former service members seen for healthcare are screened for experiences of military sexual trauma. This is an important way for us to ensure that former service members are aware of and offered free MST-related care available through the Veterans Health Administration. And it's also an important mechanism to ensure that providers are aware of their patient's history and can address any related healthcare needs. VA provides all care for MST-related mental and physical health conditions free of charge. Eligibility for this free care is expansive. Service-connected disability is not required. Individuals do not need to have reported the experiences of military sexual trauma at the time that they occurred. They do not need to have any other documentation that they occurred. The Veterans Health Administration believes survivors, and we also believe in their ability to recover when provided with the right supports. When screened by a VA healthcare provider, about 1 in 3 women and about 1 in 50 men report experiencing MST. You look at data from anonymous self-report surveys, those typically result in higher prevalence numbers compared to the estimates that come from our universal screening program. That suggests to me that our screening numbers likely underestimate the true scope of the issue. I will say that our data from the screening program indicates that the percentage of veterans who have disclosed MST experiences to a healthcare provider have increased over time. So if you look at the 10-year period between fiscal year 2012 and 2022, the number of veterans disclosing experiences of MST among male veterans rose from 1.2% to 2%. Those are small percentages, but they represent a large number of individuals. And in the same time period, among women, that number rose from 23.6% to 33.8%. So somewhat counter to expectations, this is actually a change that we're happy to see. Given the nature of these data coming from veterans reports to a healthcare provider, it's probably not necessarily reflecting an increase in experiences of MST, but instead it suggests that veterans are feeling increasingly comfortable and willing to report these experiences to their healthcare providers. It also suggests that we within the Veterans Health Administration have provided them more opportunities to do so, and with providers with whom they feel comfortable sharing this very sensitive information. Sexual trauma survivors as a group are remarkably resilient. Recovery and healing are always possible. Not all MST survivors experience long-term adverse consequences, but for many of these consequences can be significant. They can be chronic and enduring. They can span mental and physical health outcomes. They can lead to cumulative impairments in functioning and, of course, represent a risk factor for suicide. The adverse consequences of MST come with the commonalities shared with sexual trauma in other settings, and that happens in other settings. So frequently a sense of interpersonal betrayal and the high potential for negative or unsupportive reactions from both formal and informal sources of support. But these experiences are also layered with some unique aspects of the military context, in which experiences of interpersonal betrayal may be compounded by experiences of institutional betrayal, and also a risk for negative career consequences. Because MST is an experience, but not a diagnosis in and of itself, survivors' treatment is tailored to the particular difficulties or the particular health conditions that they are experiencing. Not all survivors need or want formal treatment, but for many, it can be an important part of their recovery journey. Because there's wide variation both in individuals' experiences and in their reactions to those experiences, the recovery process will be different for everyone. There are many paths to healing. MST-related services are offered at every VA medical facility, as well as at community-based vet centers. MST coordinators at every VA medical facility are knowledgeable about MST and about its after effects and about services that are available. So they are an excellent starting point for those looking to connect with services. VA's mental health services are veteran-centric in orientation and designed to meet MST survivors where they are. Some survivors may choose to focus on learning more about how MST impacts people in general or themselves specifically. They may want to focus on developing skills that can help them cope with how MST is currently impacting their lives. For those who wish to discuss their MST experiences more in depth, VA also offers effective evidence-based treatments that involve trauma memory processing. Current service members can also receive services related to MST from VHA. At VA's community-based vet centers, current service members, to include members of the National Guard and Reserves, can receive MST-related mental health counseling regardless of gender or era of service. No DoD referral is needed, and services at vet centers are confidential with respect to DoD. I'm proud of the amount of care and of the quality of the care that VHA offers to survivors of military sexual trauma. I also know that we do not always get it right. And I know that those outside of the system are often more able to see the flaws than those of us inside the system. So I am always open to hearing feedback on our services and suggestions on how we can continue to improve. The Veterans Health Administration can and should set the healthcare standard for treating survivors of sexual trauma. To those who have experienced military sexual trauma, I want to say on behalf of the Veterans Administration, we believe you and we believe in you. There are many paths to healing, and I hope that VHA's resources can play a role in helping you find the path that is the right path towards healing for you. Thanks to all of you for your time and your attention today, and for all the work that you do on behalf of veterans who've experienced military sexual trauma.
Thank you so much, Amy. We appreciated hearing about the important work VA is doing and you personally are doing. Your commitment is obvious and we are grateful. It's now my pleasure to introduce our next speaker, Naomi Mathis, a combat disabled Air Force veteran. This past summer, she was appointed Assistant National Legislative Director for the more than 1 million member DAV, having served in several roles since 2007. And as a senior member of DAV's legislative team in DC, Naomi works to advance legislation and policies critical to the disabled veterans and their families. And she has spread the word about DAV's services, including appearing in public service campaigns and interviews. While in the Air Force, she deployed 3 times to Iraq and Kuwait and attained the rank of Staff Sergeant before being medically retired in 2007.
Short people problems. Good afternoon, and thank you so much for having me here again this year to discuss such an important issue that is not discussed as much as it should be. As you heard in my bio, most of my post-military career has been ensuring that our service members and veterans' claims that go before the VA are timely and accurate. I've seen many claims over the years, and behind every claim is a person and a story. And I want to highlight two of them today, and I want to preface it by saying both of these stories are public, and I do have permission of both of them to speak about it. Let me first tell you about Migdalia. Migdalia had filed a claim and was getting denied, and I just happened to be the reviewer to see the claim. I knew something was not right with it. See, Migdalia served in the Army in the early 80s and had an extensive documented proof that she was a survivor of military sexual trauma. But instead of being helped by her command when she reported what happened, she was called a liar and eventually forced out of the service with an other than honorable discharge. The Department of Veterans Affairs initially allowed the character of her discharge from the Army to overshadow evidence proving Migdalia was entitled to VA benefits. For more than 30 years, she was left to deal on her own with the post-traumatic stress disorder caused by the incident. Keep in mind, Migdalia had not shared what happened to her with her spouse of over 30 years or with her family. After some gentle prodding from me, she finally did tell them and received an enormous amount of support from them. We began working with Migdalia through a process that would take nearly 2 years to complete. We had to convince the VA to accept her service as honorable so she could access the benefits she earned from service. The long, difficult process had kicked up everything that happened in the past, causing her at times to want to give up and not think about it anymore. So we continued working the claim by ourselves, and a breakthrough coming once we got to the VA to agree to give her an exam. It was that conversation with the treating doctor, coupled with statements from her and her family and the original records from the MST incident in 1983, that finally convinced the VA to recognize her service as honorable. I was able to share that news with Migdalia over a video call, a moment that really still gives me goosebumps. She said, "Thank you so much. I feel someone's validating my story of what happened. She is now entitled to the full VA benefits she earned and made the long hours and the challenges we faced working her claim worth it." Now, let me tell you about Lisa. Lisa saw the story written in our DAV magazine about Migdalia, sought me out to see if I can assist her with her claim. Lisa also served in the Army, but in the late 70s. As Lisa was sleeping in the barracks in her room one day, she woke up to find a man raping her. She hit him and got him to flee. She reported the incident right away to CID, the Army's version of the FBI. After making her statement and submitting to a rape kit, and once she was assured that all the information that they needed was given for the investigation, Lisa went back home traumatized. After 3 days, the Army declared her AWOL and told her to get back to base. After she got back to base, still traumatized, she signed the paperwork accepting her punishment and asked to go home. She went back home, and after 30 days, the Army again declared her AWOL. This led to Lisa receiving an other than honorable discharge. Now, in Lisa's case, it was actually much harder to get her discharge overturned due to her AWOL statuses. It was up to the veteran to convince those making a decision on her claim that the reason she went AWOL was because she just wanted to go home and begin to process what happened and to heal. This was a 3-year battle for Lisa with her claim and for those of us working on her claim. Using our pro bono clinic, Lisa had to fight the military to overturn her character of discharge, which they finally did 2 days before Veterans Day of 2022. Lisa called me to say, "I can finally say I'm a veteran this Veterans Day." That was such a great day for all of us. I told her, "Go ahead and get your free Applebee's." Subsequently, we took the new character of discharge to VA, and unfortunately, we had to start the process all over again. By this point, Lisa was tired, but I had to beg her, "Please go to this examination just one more, Lisa, please." What I really wanted to say was, "Why? All of the information is there in her file. She doesn't need to submit to this exam. But I knew that it would take one more time, and I wanted Lisa to go on with her life and put it behind her. Finally, we received the news Lisa was granted her benefits, and she won't have to subject herself to being re-traumatized by another unnecessary compensation and pension examination. Lisa texted me just before this Veterans Day and sent me a picture. She put an emblem on her car, strong female veteran. And yes, Lisa is a strong female veteran. I just want you to keep in mind these stories as you move forward. Thank you.
Thank you so much, Naomi. And storytelling is such an important part of all of your organizations. But I know DAV's made that a centerpiece. And I remember from last year hearing about this and just how important it is for people for women veterans, all veterans, to know they're not alone and that this is something that's happening to others. And it's very instructive. So thank you so much. I'm very pleased. We have two members that have joined us. I'll first introduce Congresswoman Susie Lee. She's Democratic co-chair of the Bipartisan Women's Caucus. And hello to Congresswoman Amelia Strong Seitz, vice chair. Just for anyone that doesn't know, they just finished 17 votes. And this is not it for the day, but so hence the different order than our original plans. Congresswoman Lee is in her third term representing Nevada's 3rd district. She serves on the Appropriations Committee, including the Military Construction and Veterans Affairs Subcommittee, and serves on Natural Resources as well. She has worked to prioritize issues affecting veterans, ensuring they have the resources they need to succeed once they transition from military to civilian life, particularly guaranteeing that they receive the mental health care they deserve, and has introduced several bipartisan bills this Congress, including legislation increasing access to VA mental health resources to end veteran suicide. So we are thrilled to have you, as always.
Okay, good morning or afternoon. And can all the veterans please stand up or raise your hands so I can see who is in the room? And thank you. Thank you for those incredible stories, Naomi, and for your advocacy. So incredibly important. It's an honor to be here in your presence, and I want to thank you on behalf of myself, but every American who calls our home free and the greatest country on earth. Thank you for putting your life on the line for our freedom. And I think as a member of Congress, and I hope that every single member of Congress, and that this is a bipartisan commitment, that, you know, we are quick to send people into harm's way, but making sure that we're quick to provide the resources for our men and women who return and their spouses and their loved ones, because we know that many carry the burden of war, both visible and invisible. And so I think personally, I know I speak for myself, and I'm sure I speak for Amelia Sykes, who is the co-chair, that we take that commitment incredibly seriously. And our female veterans, of course, come with additional obstacles to care. And it's and when I travel home, I just had a female veteran roundtable in advance of Veterans Day. And, you know, so many of our veterans struggle with isolation and feeling of not belonging. And you couple that on with females, when so many traditionally of the support services for veterans had been centered around basically a male framework. That's changing now, and we continue to, you know, need to work on that. And that's the one issue I hear the most from my female veterans. And in fact, my veteran roundtable, they were advocating that we have our own female women's health clinic, because so many of them, when they're going in for treatment, are again traumatized by the cat calls and things like that, that, unfortunately, many of the staff members of the VA can't really control as well. And so that's something that I'm going to continue to fight for. In the transition, one of the things, as before I became a member of the Appropriations, I was on the Veterans Affairs Committee. And I'm very committed to how do we transition our service members from active duty to veteran life, and to, more importantly, a life of dignity and respect, and more importantly, security. Making sure that we're doing everything to get education, to get our veterans into jobs. I just introduced a bill, Hire Student Veterans Act, and then to get the resources that they need. And we often hear, on average, 17 veterans die by suicide each and every day. Only 40% of them are accessing services at the VA. Given all of the stressors and risk factors that we know that veterans face, Congress needs to do more to ensure that our veterans are supported during their worst moments. And that's why I've introduced another bill, the VA Suicide Demonstration Project Act, which builds on the VA's existing suicide prevention efforts, but most importantly, stands up an initiative where not just do we say it, but we believe it, and we build our infrastructure around the idea that not one suicide is acceptable, that we need to have a mentality and we need to have a goal of 0 suicides each and every day. And that, break down some of the barriers that have prevented effective suicide prevention efforts from moving forward. But more importantly, how we treat veterans when they walk in that door at the VA is incredibly important, and how we honor the unique circumstances that surrounds their care. And so I just wanted to come here today, in a time where this government seems to be, and our country seems to be, so incredibly divided. I want you to know that we remain committed on a bipartisan manner, and that's why the Bipartisan Women's Policy Institute, and I want to thank Cindy and her entire staff, remains committed to us breaking down those barriers so that we can do everything possible to make sure we're providing all of you, our veterans, the care that you deserve and that you've earned, and that we continue to honor your service by providing those resources. So thank you all for taking the time to be here, and thank you for having this important forum.
Thank you so much, Congresswoman. It's been such a pleasure working with you and with Congressman Sykes and the Republican counterparts, one of whom may be here shortly. And we thank you for all the work you've done for veterans, both men and women. I'm very pleased now to introduce Congresswoman Amelia Strong Sykes. As I mentioned, Democratic Vice Chair of the Bipartisan Women's Caucus. She represents Ohio's 13th district and is serving her first term. She serves on Science, Space, and Technology and Transportation and Infrastructure committees, and has also introduced several bipartisan bills to support service members and veterans, hers relating to food access and security, and also protecting service members in the case of a government shutdown, which isn't over yet by a long shot. And she has certainly been committed to quality health care. And so we are thrilled to have her. And
oh, I'm sorry. Good afternoon, everyone. Good afternoon, everyone. Thank you. Thank you. Thank you. That's not just for me, but that's for all of you and the veterans who are in the room and who have served us, who are not in the room. So I think we can liven up a little. I know it's probably after lunchtime, and if I can speak for Congresswoman Lee, we are running on fumes, but we're here. So thank you for being here. I want to thank the Women's Congressional Policy Institute for organizing this and getting us together. Cindy and your team are fantastic. And I also want to recognize the women who lead the Bipartisan Women's Caucus, Susie Lee, who you just heard from, Congresswoman Kat Cammack from Florida, Monica De La Cruz, and myself round out the 4 bipartisan chairs and vice chairs of the committee. We are certainly committed to working for you, not only the veterans, but the entire country, to make sure that we're bringing forth bipartisan solutions. And if there isn't anything that I am more convinced of, is that the Congress needs more women in leadership. So to our panelists, thank you so much, Amy, Naomi, and Caitlin. Your stories, I was fortunate to hear some of yours, Naomi, that you were sharing, but lifting up veterans and telling us what we need to be doing is really, really important in the way that we can continue to progress the issues that are most important for veterans, but not only the veterans, their families, and our entire country. We all know veterans put their lives on the line every single day when they put on their uniforms, and they are defending and protecting our freedoms domestically and abroad. And as a congressperson, I get the opportunity to represent my district, which is in Northeastern Ohio, but also to represent my colleagues and the country when we go abroad on our different CODELs and trips. And one thing that has become clear is that folks all across the world look to the United States as a beacon of hope and a beacon of democracy. And the only reason that they can do that is because of the veterans, and including and especially the women veterans who have done so much to protect our democracy. And we can continue to be a leader, and hopefully will continue to be a leader in democracy and freedom across the globe. And so for that, I just want to say thank you, because you may not completely recognize how important the role you do is. Some people think it is just for national security, but truly it is about protecting freedoms and democracies domestically and abroad. And that is certainly worth mentioning. Earlier this week, I'm sure many members of the congressional delegation in Ohio and across the country participated in Veterans Day services. And one of the things I shared at the service I was at was that I wish that the room was full with people expressing their gratitude to the veterans, but it wasn't. And it seems like we go through these awareness days and recognitions, and fewer people start to come. But I don't want you all to be discouraged by that. I just want you to remember that it is important to continue to show up for the people who show up for us, the folks whose names we will never know, the folks whose names are etched on memorials, the folks who are putting their heads down and working to protect us every single day. They are worth it. And so if I can encourage you to encourage your friends and encourage everyone else to continue to uplift these veterans, particularly our women veterans who have different and unique but challenges that we can overcome to continue to allow them to be successful, we can and should do that. And I know I am standing with all of you, especially the veterans who are doing the work that we so desperately need, and will continue to stand with you. Cindy talked about a couple of the bills I introduced, and I am always one who is hesitant to list off all the bills, so I'm not going to. But let me assure you, they are to promote and uplift the work that you all are doing in supporting veterans. And if you are serving or have served, it is an ultimate, a way that we can say thank you for the sacrifices that you made. The least that we can do is ensure that the policies in place in this country protect you, support you, and allow you and your families to live a life of dignity when you come back home with injuries that we can see and some that we don't see. So thank you again. I am going to have to skedaddle. That is such a Midwestern word. I have 2 markups happening at the same time, but I wish I could spend more time with you and listening to the stories. But I do encourage you to reach out and continue to talk to us, tell us your stories so we can be the best advocates for you. Thank you so much.
Thank you.
Thank you to both Congresswoman Sykes and Congresswoman Lee. As anyone that works with the Hill knows, this is a particularly insane day. It's not just the 17 votes, but it's multiple markups and hearings today. So We will, as we mentioned, we're recording this. So for those that couldn't make it, you can share the recording with them. I'm very pleased now to welcome our final speaker, Caitlin Yancey, IAVA's Director of Policy and Advocacy. She served in the U.S. Navy for 4 years as an aviation electronics technician, 3rd class. At IAVA, she supports the organization's efforts to bring veterans' issues out of the Beltway and into the consciousness of the American public, and focuses on issues that face our nation's women veterans and service members, their gaps in healthcare compared to their male counterparts, as well as the sexual assault and domestic violence problems within the military and veterans communities. So Caitlin, welcome back.
Hello, I'm a little taller than you, Naomi. Just a little bit. Maybe it's the boots. Hello, everyone. My name is Caitlin Yancey. I'm the Director of Policy and Advocacy at Iraq and Afghanistan Veterans of America. For many years, IAVA has made military sexual trauma as well as domestic violence a priority. From the passage of the Deborah Sampson Act, which expanded harassment protections for those that experience that at VA, to the Military Justice Improvement and Increasing Prevention Act, which adjusted the way that the military handles sexual assaults and takes them out of the hands of the chain of command and gives them to private prosecutors, hoping to remove the aspect of retaliation that happens to too many survivors. The topic of MST is an issue that is not just of high importance to IAVA, but to me personally. I served in the U.S. Navy from 2010 to 2014 as an aviation electronics technician. It was one of the most fulfilling jobs that I've ever had, and I miss it almost every day. I joined the Navy because I wanted to see the world, and I hoped that one day I would become a pilot. At least that's what I told everyone when they asked me. I am not a survivor of military sexual assault, but I am a survivor of sexual assault. I joined the military to escape from my hometown and the constant reminder of what I had been through. I relived it every day because of the time that I had spent with him. I relived it every day because it happened in my house, in my bedroom, in my bed. And I relived it every day because this person decided to try and become involved with my roommate, and he was there every single day. While I cannot fully comprehend the pain that these strong and resilient men and women have, I do know what it is like to never be able to escape from those that have taken something from you and be forced to replay the horrific memories because of your surroundings. And I know the pain of not wanting to exist anymore because of the helplessness and fear that you feel. This is the reason that I joined the military. This is the reason that it took me so long to enroll at VA. And this is the reason why I do what I do. As you can imagine, joining the military because of being sexually assaulted did not leave me in the best mental space. So because of that, I decided to get married very soon after joining. I met someone in boot camp and we got married after 4 months of dating. In IAVA's most recent survey, it's important to know that 68% of those that experience military sexual trauma also experience intimate partner violence. So after knowing someone for 4 months, I decided to get married, and it was a situation that put me into an intimate partner violence situation. He was not, from the moment that we signed on the dotted line, because in the military, oftentimes you don't go to the church, you go to the courthouse because that's the easiest place to go. And a switch flipped, and he decided that he didn't want to be married. And instead of moving forward and getting a divorce, it was, let me make her feel as small as humanly possible. I will say that it took him a long time, and he never physically touched me, but the pain that I experienced just from that has lived with me every day. My husband is no longer that person. And many will say you should have left, things like that. I didn't. And by the time I figured out that that's something that I should have done, he had done the work. He had gone through therapy. He is not the same human that I would have ever expected him to be. Additionally, because of that military sexual, not military sexual assault, but because of the sexual assault, I let a lot of things pass in the military. It's important to say that military sexual trauma is not just assault. It is also harassment. So letting that supervisor who decided that because I was pregnant and I was no longer attractive to him anymore, I wasn't allowed to eat lunch. I didn't recognize that as harassment. I thought, okay, well, maybe I just need to wait for him to leave and it's okay. I'll be able to go to lunch, even though I was pregnant. I'm pregnant now, and I can't imagine not being okay to skip a meal, but I would, just because I didn't want him to be mad at me. It was the being okay with 2 supervisors following me around in my command because I didn't want to be a bother to anybody. I just wanted to put my head down and I wanted to work. And it was okay to me when the person who came over from my husband's command, who knew him, said suggestive things to me because he had seen me around my husband's command and thought that we were friendly and familiar. These are the types of situations that a lot of women, and not just women, but men go through, and they just brush them off. And it's not just because of something that may have happened to them before. It's because you don't want to cause problems. You don't want to be the person that impedes whatever's going on around you or whatever happens. You want to just get the work done. You want to put your head down. And that's how it goes for a lot of us in the military. It wasn't until leaving the military that I realized that I really needed help. I did do some therapy while I was in, but it wasn't enough for me to actually function and focus and be okay for my children. I can say today that while I still have things that I need to work on, this feeling and this pain follows me on a regular basis. I don't feel good enough. I lead our efforts here on Capitol Hill, but on a regular basis, I don't feel like I'm good enough. And a lot of that comes from my assault. A lot of that comes from my husband and things that he told me and things that he made me feel. And a lot of that comes from the things in my work and then making me feel like I was small, then making me feel like I was good enough, despite the fact that I was the highest knighthead turnout. So my job in the military was to fix knightheads, which tells where the pilots were to go. It's a priority 1 piece of gear, and a plane can't fly without it. And I was the highest turner for that specific piece of gear in my command. And despite knowing that I was that good, I was never good enough because of the things that people said to me and the things that I experienced. All of this is to say that while I can look back at myself and I can see the things that were unacceptable, I want everyone that is maybe experiencing these things, maybe not even just in the military, in your regular day-to-day life, to know that those aren't okay. A side comment is not okay. And you shouldn't be made to think that it's okay just because you don't want to cause any trouble. That's not how things should be, and you shouldn't just let it go. Additionally, it is so important for those of us who have experienced things like that, and not just assault, but also harassment, to seek out mental health care. If I would have never sought out mental health care, I sincerely doubt that I would be here today, because on a regular basis, I didn't want to be. I didn't think I was good enough for my kids. I didn't think that I was good enough for just regular everyday life. I didn't think I was good enough for this job here. So it is so important for you, if you're feeling like you're not good enough, that you go and you seek out those care, because there's a reason that you're here. There's a reason that you're in this position, and there is a reason that you got here today. Sorry, and moving on, I'm sorry. So outside of just that, outside of my experiences, there are so many different experiences that have happened. One of our members recently came forward, and again, like Naomi said, she has let me know that this was okay for me to share. She was in the military in the 1980s, back when it wasn't okay for, back when it wasn't even as regular for someone to report, and she experienced military sexual assault while she was in. She is just now coming forward and trying to file a claim and running into issues because there is no paper trail. And while I do know that VA has said that they believe us and they are here for us, it is very difficult for her to get statements and things like that. And it is a very long process for her. And that is an additional item that adds stress, and the continued having to retell of your story also causes a lot of stress. So currently in the Senate, there has been a piece of legislation introduced called the Service Member and Veterans Empowerment and Support Act of 2023, which would expand the evidentiary standard for survivors applying for disability benefits from the Department of Veterans Affairs to ensure MST survivors are provided equal access to benefits and care that they have earned. For IAVA, this piece of legislation is urgently needed at VA to best support veterans who are survivors of military sexual trauma. We want to thank, honestly, Chairman Tester and Senator Murkowski for their support in this legislation, for their bipartisan leadership and addressing the faults in the VA claims process that have led to survivors of MST being unnecessarily re-traumatized. Congress needs to act now on this specific piece of legislation, as more and more veterans do not feel comfortable going to VA and filing claims. It is imperative that we get this done now. I know that this was a little all over the place, and I apologize. Like I said, I am pregnant, so my brain is just, a little just out there. But all of this to say, I am a mother of 3 currently, and my little girl comes to me on a regular basis and tells me that she wants to be in the Navy, just like mommy. And I love that so much. I love my job. But I can't honestly tell her that that's where she should go if we continue to have the problems both within the military, within the VA. And until that point, I can't recommend that it's something that she should do. I loved my time. I really did. And those experiences don't negate the things that I was able to accomplish. And I think that's a very important note. But I can't firmly tell her to go ahead and do something. She's 7, so she has time. But I can't firmly tell her, yes, honey, you should go and do that, because I will be afraid every single day that she is there that something will happen to her. And I don't want to personally subject her to something like that. So it's imperative that we focus on this. And outside of just military sexual trauma, we focus on intimate partner violence, because it is not addressed. My situation is not uncommon. And currently the way that it stands, this could be a little uncomfortable, but currently the way that it stands, the Family Advocacy Program is the program that a lot of that is used within the Navy. This program, when I was in, was made fun of. So when I thought about trying to utilize utilize assistance and programs, the Family Advocacy Program was not an option. And so it's very important for us to kind of look at the programs that we have in the service and how can we maybe adjust them and ask specific questions about names and how people feel about specific programs before we are just continuing to utilize those programs. Again, I'm sorry, I feel like I was all over the place. But I really appreciate you all taking the time, and I'm happy to answer any additional questions.
Thank you so much, Caitlin. Really appreciate your willingness to share your journey and be so personal, as well as sharing stories of others. Again, it's just, there's a reason why we focused on mental health issues with this series for almost all of the 20 years we've done it. It's so clearly front and center and has to continue to be. Progress has been made, but there is just so much more to be done. So thank you again. Making sure that people don't feel they're the only ones is probably one of the most important things. So you both, and Dr. Street with your work too, you are contributing so much. We're going to go ahead and move to Q&A. And thank you again to each of our speakers. If you have a question, please raise your hand. Erin Bigler, our intern and staff person, has the mic and she'll bring it to you. Please state your name and your affiliation before asking your question. So we will open it up. Don't be shy. Okay, good.
Hello, everybody. My name is Tiffany Garner. I work as a child and health policy advocate with Futures Without Violence. We're based here in DC. But one of the things I wanted to ask about, and correct me if I'm wrong, let me get it right. When veterans or current service members, when they go for, let's just say, mental health screenings, are there screening questions when it comes to IPV on some of the assessment processes that you all have? I'm just trying to see how you all gauge if someone is not forthcoming about IPV. How do you all assess for that?
Yeah, thanks for asking. Interpersonal violence, regardless of whether it's sexual trauma or intimate partner violence, has so many commonalities that medical best practice is pretty similar across interpersonal violence screenings. And in fact, the Veterans Health Administration is the largest interpersonal violence screening in the world, because of the fact that we screen every veteran for military sexual trauma. We do also, as a part of good clinical practice, screen veterans for experiences of intimate partner violence. There's some data suggesting that veteran women are at higher risk than civilian women for intimate partner violence. So it's an important part of care for veteran women, as well as the associated interventions. So once you screen, what do you do about it? Whether that be a sort of acute intimate partner violence situation, or whether it be struggling with the longer term mental health consequences of those experiences. And we do at every VA medical facility have an intimate partner violence coordinator who manages those services for women, as well as our military sexual trauma coordinator.
I don't need the mic. Can you hear me?
It's for the
We-
recording.
We need it for the recording.
Sorry, that's intimidating. Hi, everyone. My name is Marina. I work for Rep. Ramirez. She's a member of the House Veterans Affairs Committee, and certainly women is one of her priorities, and addressing MST is one of her priorities as well. I think one of the things that we've been sort of thinking through, I know there's been a lot of really great work on the armed services side. And I know that the VA has been doing a lot of great work with VHA, with their MST coordinators, but I was wondering if you're collecting data, which I know poses challenges because a lot of folks don't like coming forward. But if you are collecting that data, how is it being used? Is it being disaggregated by demographic information? I'll start there because I have a follow-up question.
Sure. Before my recent movement into healthcare policy, I spent 25 years as a researcher, mostly focused around military sexual trauma and other forms of interpersonal violence. So I'm a real nerd, and I love numbers and I love data. And so we do try to make the basis of all of the work that we do and the decisions that we make very research-based and data-based. And because of our universal military sexual trauma screening, we do have anonymized data from VA medical records where we can look at large epidemiological patterns. And we actually have an ongoing initiative now. We have for a long time looked at those data disaggregated by men and women, obviously, because gender is so strongly linked to these experiences. But are undergoing analyses now that also look at other demographic identity variables, like, for example, race and ethnicity, and also age and era of service, disability status, so that we're just better able to understand the patterns of what we see and identify any differences in healthcare utilization and potential disparities within the MST community that we can figure out how to address.
Thanks. That's really helpful. And of course, I am a student and I'm learning. And so this is just more a question of curiosity. For MST coordinators, is there any training that they are given on cultural competency? I know, going back to some of that, there are a lot of cultural pieces. There are a lot of veterans who come from, low socioeconomic communities, that come from communities of color, Black and brown folks, who that just in the identity itself, that is a barrier to talking to family. And certainly in the armed services, and as they're transitioning out, there are other cultural barriers there too. So I'm wondering if there's any training that MST coordinators have to go through, or if there's a, sort of a prerequisite for treating veterans who do come from those marginalized communities.
Yeah, this is a critically important issue. So thank you for the question. We infuse an understanding of how demographic and identity differences intersect with the experiences of sexual trauma through all of our training, because they are so incredibly integrated in such an important way. So we know in terms of risk for sexual trauma that any factors that decrease institutional power or organizational power or societal power increase risk for the experience of sexual trauma, which means that our veterans coming from more marginalized backgrounds are more likely to have experienced things like sexual trauma. And then on the other end of the experience, we also know that those kind of identity variables impact the likelihood that someone is willing to come forward to talk about those experiences, the likelihood that they will get the help that they need when they do come forward, the likelihood that they will be believed. Certainly among marginalized communities, there is a historical and understandable distrust of formal helping systems. And I don't think that we can effectively treat our military sexual trauma community without understanding the ways that those factors intersect with both the experience of sexual trauma and the experience of recovery from it. So we do infuse that very heavily within our trainings for MST coordinators and all providers within VA.
Great, thank you. I have like 20 more questions, but I'm not going to.
Hi, thank you for coming out. I'm Samantha, well, Master Sergeant Samantha Payne, so I'm active duty Air Force, also a survivor of MST. I wanted to ask if you had support groups, and if so, can active duty members join those support groups in any of your organizations?
So I think the best place for active duty service members is they certainly can receive care at our VA medical facilities, our sort of kind of standard VA hospitals. But to receive care there, active duty members need a kind of standard TRICARE referral. And so TRICARE co-payments may apply, and records are open to DoD through DoD VA file sharing. But at our freestanding community-based vet centers, all active duty service members, to include National Guard and Reserves, are eligible for care without a referral from DoD, and also records are confidential from DoD. So I think that's a really fantastic treatment location for active duty service members. And that kind of community-based support group model is really common in the sort of recovery, sort of grassroots approach that vet centers take to care. So I think that's a really excellent option for care for someone looking for support groups who's an active duty service member.
1000%. I wholeheartedly agree. I actually know a group of young service members that they're having trouble on their base, and that's exactly what I told them to do, was to go to the vet center. They have excellent community support, peer support programs. They even have retreats and stuff like that. So I highly recommend the vet center.
I'll also just use this opportunity to make a plug for another resource that I'm very proud of, which is the Beyond MST mobile app. So it's free. It's available in the Apple Store or the Google Play Store. Anyone can download it. And if you're looking just to learn a little bit more about military sexual trauma, to find some tools that can be helpful for all of us in sort of coping with challenges in day-to-day life, or look for more information about what kinds of treatment resources are available, I think that's a really nice place to start.
And thank you for your service.
Father Rochelle Cawthon. I am the past department commander for the American Legion here in the District of Columbia, and whole list of all the things. I'm a life member of DAV and VFW and all these things. But I want to make a comment, and I do have a question. Comment for my sister in arms. I understand what you're talking about, not because I personally experienced. I had a friend who took her life because she did report, and I was the last person to see her life. And I deal with the trauma of why didn't I know when she left me that she was going out to her car to drive down the road. I understand when you say you didn't tell your spouse, because what happened was she finally told her spouse, and he badgered her. Her parents badgered her, and today she is in an unmarked grave because the family refused to allow the VA to, or the service Marine Corps to put the marker on her grave. And Stephen Cohen Clinic in Silver Spring, Mallory Lass, Mallary Lass. She is a wonderful person to reach out to help other active duty individuals get resources for free without having to go through the military. We discussed this in August. I asked, will you all make it more inviting place? Because what do you do when people report and the ostracism that they get afterwards? Because you don't know how to keep it private. You don't know how to keep it confidential, and you don't know how to make this space safe. My question is this. I've dealt with a lot of service members. Being in the Marine Corps, A lot of times we're 106 men to every one woman. And so I had a lot of active duty members when I was active duty, and since then that I've dealt with that have had trauma, and it took years for them to be able to talk to someone about it. Well, we do the claim and they get their compensation. But what happens to the family afterwards? I'm a retired educator. I had to teach these children who live in households where they were traumatized by their parents. Their parents are out, they're veterans. The VA does not offer any services and can't for the families. A lot of times the families are over-incomed to get the help or under-income to get the most adequate help. What can we do about providing trauma therapy services for the families, whether their children are 15 or 35 years old because they were traumatized, whether that spouse is still married to that male or female or not, or that household partner at the time, because they too need to be made whole. And I'll yield the floor. Thank you.
So I will say, it's not something that, that DAV focuses on. We definitely focus on service disabled veterans and their survivors. But I will say this, that there are a lot of other nonprofit organizations out there that do actually focus specifically on this. I know when I first got out, my trauma, my PTSD, it was not MST related, but it's combat related. And my children suffered. I was a single parent with 3 children, and my children suffered greatly. They ended up, my 12-year-old ended up being my caregiver, basically. So, but there was an organization that kind of stepped up and did some trauma-based therapy for them and help them to kind of get over that transition hurdle for me or with us. And so I don't believe that that organization unfortunately exists anymore, but I will say that there are several organizations out there that do focus on that. And I can't really off the top of my head think of what they are because it's been so long for me, but I will say that it does exist. And if it doesn't, you can always start one.
I think you bring up a very a very good point, though. I mean, oftentimes we think about the veteran, like you said, the veteran who has experienced something, and we don't often talk about the family. I mean, yes, like Naomi said, my children were definitely traumatized by what happened within my household, not just because of my own stressors, but because my husband was not the person that he should have been from the beginning. And so I think it's very important they tell you, like, when you get on an airplane, put on your mask first before you assist others. So yes, it's very important for you to work on yourself and, heal, but then you do have to look at those who have followed you and who have learned from you and make sure that you are also taking care of those. Once you've cared for yourself and you are in a good place, make sure you also do care for them. And like Naomi said, there are a lot of community organizations. I know that, there is that income bracket where like you don't make enough to actually be able to afford it on your own, but you make too much to actually qualify for assistance. And I think that that's something that we can definitely start taking a look at and see how we can help military families and military connected families through that process.
I say that because I'm dealing with some service veterans who are being treated, but now they're saying, I can't go through this treatment because I'm have these issues with my children in the household, and I can't, they're all over the board with their own care because they can't help the individuals in their household. So that affects them again. They're being re-traumatized all over again. Now they have a new trauma and now I'm feeling more guilty about what I caused that I really didn't cause, but I did, cause.
I will say, and correct me if I'm wrong, vet centers do provide some family therapy. So that's also another option.
Yeah, thank you, Naomi, that you're right. And you're right that the VA does focus primarily on the veteran, but we do have some pockets of family services available. And one pilot program that's currently gearing up to happen is a pilot of a parenting intervention for survivors of military sexual trauma. STARE for Parenting is the name of the intervention. STAIR, STAIR for parenting. And we're piloting that amongst military sexual trauma survivors specifically because of the issues that you raise, that if you're suffering from PTSD or depression or substance abuse or whatever after effects of the sexual trauma that impacts so many aspects of your life, particularly relationships. And I think particularly, I mean, parenting is challenging, full stop. It can be particularly challenging when you're trying to do it with the load of some mental health challenges.
It's me. I'm back. I'm sorry. I was just like, literally, there's no one else. I'll do it. Because I have lots of questions. So again, just want to thank all of the panelists for presenting, certainly for sharing your stories. I have a question about housing, especially as it relates to IPV. Do you know, and I guess this is it's for all panelists, if survivors of IPV have run into the issue of housing, if they're living with their spouse or if they're in a situation where there is economic control, has housing been an issue in that space as it relates to MST or IPV?
I would say yes. There are several programs around, sorry, I'm awful with mics. There are several programs around the country that help veterans, not just that are experiencing intimate partner violence. I know that the one closest here, I think, is First Salute, and they also accept children, so that's helpful. But a note, like we said earlier, this does not just impact women. And an issue that we have learned is that oftentimes shelters will not take both men and children. And so if a man is going through an intimate partner violence situation, he needs to leave his home and take his children with him. Oftentimes they will separate the children from the father, which can be re-traumatizing. And so if you have a choice between staying with your children in a intimate partner violence situation or being separated from them, which are you going to do? Because I know as a mother, I would never leave my children no matter what. So that is a unique situation that we see, but there are programs around the country that do assist, but it's primarily women with children or men.
This is a bit tangential to your question, but I'll raise it here because I think it's relevant. The Department of Veterans Affairs has a Veterans Health Administration branch and a Veterans Benefits Administration branch. I work on the healthcare side, where the threshold for access to services is relatively low. On the veterans benefits side, which is focused around disability compensation, the threshold is much higher. Some of the short stories, very compelling stories that Naomi and Caitlin shared are really about that veterans benefits process. I raise it because it's relevant to the issue of financial resources, which I think can be so critically important as a part of recovery. Mental health care is important, but financial resources are functionally incredibly important as well. Our office is increasingly partnering with the Veterans Benefits Association because we have a wealth of experience and knowledge and understanding providing care and services in a trauma-sensitive way. And so there are 4 active pieces of legislation now that we're working with VBA on to look for ways to make that process more trauma-sensitive, particularly for survivors of interpersonal trauma, in hopes that both the process and the pathway to those kinds of resources can be smoothed, so that we don't have to continue hearing these heartbreaking stories about how hard it's been to access benefits. And I think those kinds of financial resources then make things like housing and other just kind of functional needs so much more feasible and possible.
Thank you.
No more questions, Marina. No, I'm just kidding. I'm just kidding.
Hi, I think some of you know me. I'm from Senator Tester's SBAC staff. I'm Abby. We know that this military to civilian transition process is a really vulnerable time. Congresswoman Lee talked about it a little bit. It's when suicide rates spike and lots of other things go on. Do you have any suggestions for how to improve that transition for women veterans in particular? Because I know TAP and a lot of those things don't have a lot of women veterans specific kind of modules or things like that. So any suggestions you have to improve that process?
My colleagues here can probably give you much more real and experienced answers than I can, but I will just share that one thing in my work that I'm very excited about and I think has the potential to make some real change is under the offices of the Shared VA DoD Joint Executive Committee, which works at a very high level to address challenges across systems that make that transition process more challenging than it needs to be. There is a committee that I co-chair with a DoD colleague that is focused specifically on that transition time for survivors of sexual trauma. And so we spend a lot of time trying to think about what resources we can share on the DoD side with service members who are transitioning out, who may not have reported their experiences of sexual trauma, but can still learn about the resources that are available to them. And similarly are looking to tackle in this upcoming year a memorandum of understanding between the two agencies that can also help smooth the disability compensation process. I think TAP is useful and important. I think it's not the answer. And so finding as many ways and as many touch points that we can provide information to service members so that they have the information they want at the moment when they need it is an incredibly important part of that process.
Yeah, I agree. We heard about this in a meeting just last week, and we're very excited about that actually. But I will say that, transition, they need to understand that transition for a service member, there's a 365-day life cycle, and it needs to start at day one. And the service member needs to be allowed to transition, and they need to be allowed that grace to be able to, bring forward anything that's happened to them or anything that they might have experienced that will affect their healthcare and their benefits down the line. And that's unfortunately not happening. And, it's a DoD issue, I believe, at that point. But the transition time period is just so critical. I know, particularly for someone in my case, where I was a combat veteran, I was being transitioned. They took my job away from me. Like, that's how I felt. I was, went through all of this, and now my mind's all messed up. My kids are all messed up, and now they're firing me, with benefits. That's essentially how I felt. And so I believe that VA is doing a lot more to tackle situations like that and to really try to become more proactive rather than be reactive. There is a module that one can take in TAP, and it's online, and we've made many we've been jumping up and down about this. We believe that it needs to be a little different. It needs to be more, and it just doesn't go, far enough. So anyway, but that's all right. I'm off my soapbox. You get it.
Something that one of our members brought up to us is the idea of, so like when you're in the military and you're going to a new command, you get a sponsor. That's just a normal thing. They contact you and they let you know that, like, hey, I'm here. Like, you need anything, like, let me know. I'll show you around the base. If you want me to, you don't have to, but like, if that's what you want, like, sweet. And so one of our members brought up the idea of like a veteran sponsor. So someone who's in your community, who's been vetted through the VA on a volunteer basis, but again, vetted fully, that you opt in while you're in the service, and you're able to get in contact with someone who's transitioned, who's, quote unquote successful, or like it's successfully transitioned out of the military, and just like help you navigate VA post-transition life. That immediate feeling, like Naomi said, of like you were fired, or in my case, like I quit, and that was awful in like my brain. It would just be a very helpful step where that there's somebody who's already gone through that process that you have the phone number for, or like a contact information for. So like, even if you don't want to use it right then, it's there. Like, maybe like 6 weeks, a month, 6 months down the road, like, oh, I do have someone, I'm like struggling and I don't know how to do this, but I have this person's information and I can reach out. Again, vetted person, but volunteer basis. And I think if it was where you could, like a woman could you choose another woman, because that's what made them feel more comfortable. As a woman, that would make me feel more comfortable. I think that would be it would be a very difficult thing to legislate and implement, but could also be very helpful to a veteran that's struggling through transition. Yeah, but you don't get it. No. Yeah, like
This will be our last question. Well, I have a last question after.
So this isn't really a question. This is kind of a follow on to what you just said. I'm Emily. I'm a Army veteran and I'm actually only here for 12 months. I'm a defense fellow. And as you see, I hate speaking. Tell by my voice. It's just not what I like to do. But there are programs and opportunities to volunteer. I separated 5.5 years ago. And the first thing I did was, how can I get back involved? I love my volunteer work. I like to help. That's what drew me to the military. I like that civil service. So being able to find an organization that allows me to come to DC, work with fellow veterans, help clean up the National Mall, clean up behind the lazy people who they see the trash can, like, this spot's better. To clean that up, it gives you a purpose. And then through that, you can find people of common interest. You can find people who have gone through the MST, who've gone through the IPV, who have these situations and these scenarios that you never would have met. And I highly, highly encourage it. They're not out there for everybody. And again, I don't like talking, but I would volunteer for what you just described. I would happily help someone else because I filed my claim by myself. I did everything by myself. I walked out the door. In 6 weeks, I had a claim I was 94% disabled. I had never reported my military sexual trauma, none of my problems, but I came out by myself. And that's what we as women do. We find a way to make things work, even by ourselves. So if that ever happens, please find us. We'll help. We'll all help. But if you have organizations that you know of, contact people, let them know, hey, like Mission Continues is one that I've been really big with. And we do so much good work. I volunteered on the 11th. Didn't get any of my free meals. Meals didn't matter this year. I just wanted to help. So I would just encourage that. And I really do appreciate everything you guys are doing today. And again, sorry, shakiness. I don't like to talk.
I do want to clarify. I think I said opt in. I meant opt out. And that if this was something that someone was interested in, I would firmly encourage that the contact information only be given to the veteran transitioning. You don't want to, badger someone who may not be wanting to talk, even if they didn't opt out. So the contact information only given to the veteran transitioning, and then they can reach out if they want to, just for clarification.
Caitlin, it's certainly not as extensive or as exciting as what you're suggesting, but the VA has invested pretty heavily in peer specialists within the VA, and certainly specific to MST, we think this is an incredibly important treatment in and of itself, or pathway into more care. And so we've been thinking a lot about how to use peer specialists to support care for MST survivors. And one of the things we're doing is pairing up peer specialists with the Beyond MST app to provide some kind of coaching. Because I think that the thing that's sort of at the core of what you are getting at is this lived experience, and the way that the wisdom that comes from that makes you such a trusted source of information that is, I think, more effective and powerful than however many letters or after however many person's name. So I think that's a pretty cool idea.
I do. I like it.
All right. Well, thank you, everybody that asked a question. There were excellent questions and observations, really helpful. I have taken copious notes. And trust me, we really do listen to this, and it gets incorporated into the next event. Our panelists know the question I'm going to ask. We want to end this before I close. What are one or two primary takeaways you would like policymakers attending today to consider in their work? Whoever would like to go first. Caitlin, everyone's looking at Caitlin.
I think one of the biggest things that I would like not just policymakers, but everyone to take away from this is to take care of yourself, take care of your mental health, take care of, and like was brought up earlier, after you've made sure that you are okay, make sure that those who you care for and surround you are okay. And I also like, this wasn't originally something that I was going to talk about at this portion, but I do like also what you brought up in the fact that oftentimes we do not have services to care for those who have been traumatized by our traumatization. And so how do we go about looking at helping them and ensuring they're cared for, because they are also part of this. And if it's a cycle of guilt and stress and re-traumatization because of the things that have happened, we need to be working on the whole picture and the whole family, because their health matters to us just as much. So I think that those are some things that I'd like taken away from this.
And I'll say to remember Lisa and remember Migdalia, remember those stories and how difficult that was. And those, I mean, those were just two stories that, I mean, there's thousands and hundreds of thousands of them out there. Remember that, you know, suicide prevention, this also ties into that. You know, we want to think about suicide prevention. And thank you for stealing my thunder as far as the SAVES Act. I actually was going to mention that here in this portion, which is there, it doesn't have enough co-sponsors really on, and it's in both chambers. It's in the Senate as well as the House. And we think it doesn't get enough attention, and it really should. And it is MST specific, the Service Member and Veterans Empowerment and Support Act. It's a long acronym. Okay. But yes, I think that's my key takeaway.
We appreciate all the focus on the issue of military sexual trauma amongst veterans for all genders. We appreciate the partnership in trying to improve care and benefits in whatever way we can. When that support comes with additional resources, that's always incredibly helpful in terms of removing barriers to implementation. The other thing that I would say is that we are very focused in our delivery of services on systems and interventions that are trauma sensitive. And by that, I mean that come with a choice on the part of the survivor. The veterans who I treat are not wounded birds. The veterans who I treat are incredibly strong and incredibly powerful. And so even sometimes well-meaning pieces of legislation, but that remove power and choice from the hands of the veterans, I think can sometimes be contraindicated even when they are well-intentioned. So I would also support efforts that continue to take that approach of providing choice for veterans, strengths-based, recovery-focused, and empowering, because I think that's the key to recovery overall.
All right, thank you so much. We really appreciate our speakers for their presentations. As always, several repeat speakers, and it was so great to meet you too, Amy. We hope this briefing has provided everyone here with a better understanding of the unique experiences and health challenges, and will serve as a resource for policymakers. As noted many times, this conversation was recorded and should be available for viewing at our website at wcpinst.org next week. And a short survey about today's discussion, you can either do access by the QR code every other seat, or you will receive it via email for those attending remotely at the end of the briefing. Our thanks again to the Bipartisan Women's Caucus leadership, both members and staff, our co-sponsors, DAV and IAVA, and Otsuka America Pharmaceutical, Inc. for their support for this briefing. And finally, my thanks to the WCPI team, Alyssa Innes, Afnan Adam, Aaron Bigler, Faith Chung, and Tanvi Prasad for making this briefing possible. Thank you for joining us, and we will see you next year, if not sooner.